Hi everyone, welcome to part 2 of our Master Series on fertility. Today we're going to expand a little bit more of what we did in the part 1 session. We basically covered in that one a lot of the causal factors associated with infertility. This time around I think we'll sort of do a bit of a prequel and we'll probably try and cover more of the preconceptual care that's involved with prepping couples that are trying to have babies, and we'll also incorporate what I would apply in a clinical situation to help with couples that are possibly having to require to go through IVF as well. So just a sort of slight backtrack from the previous one, because we did cover a lot of causal factors previously, but this time I would like to sort of get really right down to the essentials, and this really basically covers the fundamental of natural medicine. Basically, helping the vital forces of the body, work better, and basically help to facilitate the body to try and find a state of homeostasis or balance, and to get them as close to a pinnacle of wellness. So this will open the window for enhancing their fertility, and hopefully having babies will come as a consequence of correcting these underlying issues. So what I'd like to start off today is basically covering the basic foundations that we need to do when prepping couples to make babies. In the previous talk, like we were just saying, we sort of covered more in the middle section, more to do with the causal factors, like the PCOS, endometriosis, men with varicocele and things like that. But more importantly, we need to get down basically the fundamentals of getting intracellular function working properly. And we're going to really start at the very beginning, get right down to the microcellular level and build out from there. So basically, that we might have covered in the previous talk, is that a woman's true menstrual ovulation cycle actually truly happens over a 90-day cycle. So even though you have your month by month from a month cycle, assuming that a woman has what you would consider a normal cycle at around a 20-day mark, 20 to 30-day mark. So it takes that time for the maturing egg or ovum to basically develop, and the chemical reactions that happened 3 months ago are basically what help mature the ovary to come through, and that's the egg you end up ovulating with. But most people don't realise when you ovulate, you're not actually losing one egg every calendar month. You actually lose that one egg that you hopefully will ovulate with, and it becomes the leading follicle that out matures all the others, and it becomes the winner that month. But there's probably more, so around 500 to 1,000 more immature follicles that go through a process called atresia, so they die away. And the sort of golden standard that a lot of couples that we see that come in for fertility are usually from the 35 age group onwards, Mark. And that's sort of always been considered the magic line in the sand when fertility issues start to become more significant. So when you think about it, the egg loss rate that a woman's probably gone through from the time of puberty to the time you hit your mid-30s, there's probably a 250,000 eggs that have been lost in that time frame. So, and because of processes due to lifestyle, oxidative damage, epigenetic factors, there's so many environmental issues. There's about 77,000 chemicals that are used domestically now that wasn't around 50 years ago, and the pooling effect of these chemicals that are having on the structure of our chromosomes and things like that, even though they may not be mutating it, the things like the epigenetics, where they may be changing the sequencing or how your body can read the information off your chromosomes, that is really what's impacting nowadays. And the men are really being affected at an incredible rate compared to what it was a few years back. There's actually less males being born in the last few decades than there were previously. So you have to think, okay, why is that going on? And you have to assume that men's sperm counts in that time frame have really declined massively. And generally speaking, males produce a lot more male type of sperm than female type of sperm as a general rule. I mean, the male sperm are much smaller. You can physically test for these things. They're much smaller in size compared to the female sperm. The female sperm is a lot hardier, so they can handle more hostile environments. So if the ladies reproductive system is a bit more on the acidic side, the male sperm do not cope very well with that. So if you're actually trying more for a girl, you have a higher chance of conceiving with a girl in a more acid type of environment where it's more alkaline. If there's more numbers of male sperm, and they are the fastest swimmers out of the two, so it's like the tortoise and hare race, trying to get to that egg first. If in a more acidic environment, and if you're further away from ovulation, say 2-3 days prior to that ovulation date, most of the male sperm will probably run their race by then, and usually the female sperm will come up and pip the boy sperm at the finishing line. And so it's almost got to a stage where it's almost a 50-50 percentile with boys and girls being born now. A few years ago, there was, even 10 years ago, the men, there was probably 104, 105 boys conceived to 100 girls. So that is declining massively. Getting on to sort of the chromosome issue, nearly 1 in 5 of every sperm that gets tested nowadays is shown to have some sort of morphology problem. So you've got to think, you know, that is a massive amount, and it is getting worse and worse and worse. So one of the big areas that we'll sort of touch on a bit more today, we would be amiss if we don't sort of touch on a lot of the nutritional prepping requirements also required, even though we shall be focusing a lot on the liquid herbal extracts also, but we need to sort of get down to the beginning, because both of these very much are synergistic to one another. And there's massive amounts of research, obviously, into nutritional medicine as with the herbal medicine as well. And the way I practice, I tend to go a bit 50-50 with basically combining both. So what one doesn't cover, we cover with the other. We sort of cover all bases, and hopefully we get a good result at the end of that. So what I'd like to do is actually start at the beginning and get down to the microcellular level and basically give you a quick overview again of really what we need to do to get everything sort of working properly once we start incorporating our treatment protocols. So basically, going back to basic science, you know, every cell has a lipid moiety membrane around it, and inside that you've got your nucleus, your cytoplasm and your mitochondria. So this is pretty much the case in the whole body. And actually one of the cells that lasts longer than any other cell is the ovum, is the egg. And the consequence of that too, being it sitting around for all this time, it is going to be more prone to damage in many ways. So what we need to do is get the cell functioning as optimally as possible as we can. One of the big problems with modern diet, and especially in Western diet over recent years, and this is nothing new that we don't all know about, that you know, the calorie intake that we have nowadays is you know, quite high in compared to the micronutrients that we are receiving in our diet. And one of the fundamental things that is very proportionally out of balance is the role of essential fatty acids in modern diet. When you look at most of the processed foods and a lot of the takeaway foods we have now, the omega-6 amount of foods that we get is very disproportionate to the amount of omega-3 fatty acids that we get nowadays. Most of us in this industry all know about the role of essential fatty acids. It's one of the cornerstone nutrients that our bodies require. That's why it's essential. It's absolutely important. The thing with the omega-6 pathway of essential fatty acids and how they work, they are an inflammatory pathway, where the omega-3s are an anti-inflammatory pathway. And if you look at most of the structure of our cells within the body, essential fatty acids make up a massive component of that. So once we sort of get into our treatment protocols, once we get into taking our liquid tonics, taking our nutrient supplements, if you get into your superfoods, all those type of things, that's all fine and dandy. But if your cells are not receptive to uptake those vitamins, minerals, trace elements, phytochemicals, then everything sort of goes a bit pear-shaped, really. So we want to really try and make sure that at an intracellular level, everything is functioning as hunky-dory as we possibly can. And by doing this, this is going to maximise any other treatment protocol that you will hopefully apply to get everything to work in a more maximal or efficient way. So the cell membrane basically has all the different receptor sites, the different enzymes and hormones and chemicals, and you've got sodium, potassium pumps and things like that. The thing is, again, if the cells are too thin or too fat, we've got equal problems, just like what happens in type 2 diabetes and things like that. The receptor sites basically stretch out of shape. The chemicals cannot basically couple to the correct receptor site and aren't sort of welcomed into the cell, but it's a two-way street. And the problems with the cell cannot then liberate the metabolic waste and toxins that it needs from just even day-to-day processing. So the role of essential fatty acids is going to be very, very important, and it's one of the first things that I always do with pretty much every couple that I see with fertility. It's pretty much a stock standard protocol that I apply. Dosage range will vary quite significantly, depending on body mass and things like that. So usually the rule of thumb is, at least probably about 3 grams a day in a supplemental type, and particularly one that's got a very high EPA, DHA content, particularly in pregnancy, and Mel would have extended that in her talk. During pregnancy, I like a very high DHA, because from the metabolic pathway of when you break down your omega-3, your DHA is sort of at the bottom of that metabolic pathway. So basically, it's absolutely crucial, and even beyond the fertility and baby making, this is really the foundation of wellness. You've got to get this absolutely right from the get-go, because basically, the way I approach fertility, I tend to really review most people's case histories, and it's probably where I'm a little bit pedantic. I'm pretty thorough at sort of getting a really good back history. So by really using a bit of detective work and sort of having a look what these people have presented with and what their journey's sort of been to why they're coming to see me at this point in their time, it will give me a lot of insights of where trends are heading for the future. And it would sort of help as a matter of deduction to deduce what level of initial treatment protocol that we need to go in with these people. Usually in the first month of treatment, I would basically class this as our detoxification or cleansing phase. So that's really stage 1. And again, that's very fundamental to most health problems related to herbal medicine and holistic medicines. And this is crucial, like we're talking about getting the health of the cells. I mean, we turn over about 1 trillion cells daily, 1 trillion cells. And so it's a massive production line that's involved. And every time a cell is replicating, we want to make sure that the one that's taking its place is as good as Nick. And this has got a lot to do with how we physiologically age, improving our longevity, hopefully. But really getting down to it, it's about our quality of wellness, our quality of health is going to come right down to the cellular level. So basically, we apply the essential fatty acids really as a cornerstone to adjuncting with our nutritional protocols and our liquid tincture herbal protocols as well. So once chemicals and that can get into the cells, then you've got to get into the nucleus, and this is where all the chromosomes and everything is working. And you also got to get into the mitochondria to get all the energy systems of the body working. And what do they have all in common? They have a fatty membrane around the outside. So it's like, tuning a TV into the right station, and if your antenna's been bent or broken, you're not going to get the right signal. So, and it's the same with us applying. So we can give everyone the liquid tincture herbs and things like that. But if you really want to get the best result, because it's fine and dandy, but if you look at what's contained in a liquid tincture, it's packed full of vitamins and minerals and trace elements and phytochemicals and all these other sort of nutraceutical things. But again, when we're talking at a receptor level, and if it's not working, you can dose quite highly with a lot of the herbs and you won't be getting the same therapeutic result. So this is a way for getting our cells working better. They'll uptake the treatments that we're applying, and hopefully by doing that we'll maximise our result. So basically what I'd like to do is start from a breakdown of what I normally do in a general consultation with initial fertility patients when they come in. So basically, our advisement is really trying to make them aware that the physiology body, when you're prepping to make babies, can take several months. We're talking probably at least a 3-month protocol. If a lady is actually getting off the pill and that, we might have to advise them it might take a little bit longer, because we really want to get a lot of those sort of chemicals out of the system, and we want to sort of get a true indication of what her menstrual cycle is doing under its own steam, and it's not being chemically assisted like when it was just coming off the pill. So it may not give us a true reflection. Phase 1 that basically we're going to work on is the detoxifying and cleansing phase. So I usually apply this in the first couple of weeks, maybe the first month of initial appointment with fertility couples. The dosage of herbal medicines that I may apply or nutrients that I apply this will greatly vary. You've got to look at the person's back history, what their back diet's been like, if they've been hitting the junk food quite a lot, what their exercise activity levels are like, and things like that. Do they present? Do they have acne problems? Are they gaining weight? Are they feeling very tired and sluggish and things like that? So these are all the things you've got to deduce to sort of come in and sort of guesstimate what sort of level of intervention that you think would be appropriate to provoke the ideal response in that early stage. Now, with detoxification, there's a lot of train of thoughts on going with that. Some people tend to go pretty hard, and my concern is a lot of people that are coming into you, and I know with the fertility patients, sometimes this is their first experience in natural medicine, and the one thing you don't want to do is go too gung-ho off the start, because the last thing you want to do is provoke like a severe healing crisis or something like that, and they end up with really bad diarrhea and their skin breaks out and all these sort of things. These are the things you want to make them aware of, that these are the possible likely outcomes. But I tend to err on the side of caution, because it's basically, first do no harm. And the thing is that we don't want our patients running away from us if they get scared off the beginning. Because my first month of protocol is usually probably the most aggressive stage, because what we do in that first month is really going to dictate the egg quality and the sperm quality 3 months from now. And that's what we need to tap into. So sometimes you need to make your patients aware we're going to sort of hit it pretty hard off the start. And hopefully, if we provoke the right response that we want to see, then hopefully we'll scale this back and basically we'll taper it into. So once we start seeing an outcome over the next few months, it's a bit harder with the men to see that, because obviously it's not like you can see all this great new sperm that you're making and things like that. Girls, it's a lot easier because you've got the menstrual cycle as a guide to work from. So basically you can observe, what changes might occur. Did the period come longer, shorter, heavier, lighter, clottier? What were the moods like? Was it boobs, or all those sort of PMS markers? And these can give you great insight from the signs and symptoms to give you some insight into underlying pathology that may not have presented before. And if some people have a fairly profound effect, like some of the girls, might have more clotting periods once you sort of introduce a bit of a detox in there. So this is probably giving you a lot of information to say, okay, maybe their eliminatory function was not working flash beforehand, and none of that might have been picked up on any previous pathology before. So it could actually be a blessing in disguise. It's a little bit like taking 2 steps back to go 10 steps forward, doing a detox. Sometimes you have to sort of jump through the fire to get to the other side, and sometimes just applying that alone could be enough to sort of unblock a lot of congestion in the body, and that could be just enough to hopefully open the window for couples to fall pregnant. So with most of the sort of detoxification protocols, from a herbal medicine or liquid tincture point of view, most of us use most of our liver detoxing or depurifying herbs. St. Mary's thistle is usually always considered, or celebum is always sort of on the top of the list. It's a great liver protector. It's chock full of antioxidants, and that's the thing. Once you start provoking a detoxification effect, We've got to sort of make sure we protect the body. I mean, the liver, has nearly 3,000 biochemical functions, and especially in Chinese medicine they believe that, but it's sad in Western medicine they don't sort of apply that so much to the liver. It's sort of a bit forgotten about. And the cells regenerate, and the liver stores more glycogen than pretty much any other organ of the body. So Samari's thistle is always one to consider. I like using a lot of Schisandra because it provokes phase 1, phase 2 detoxification. Again, it's a bit of a nerve-on adaptogen as well. And it's good for clearing the excess of bad estrogens. Probably not as strong as other ones that we'll probably talk about, but it is good protocol that can be applied equally for both men and women. So it's a really good herb to look at. Dandelion root, fantastic herb, hepatoprotective, mildly detoxing. Great, because once you start provoking a detoxing action, you've got to make sure that the other eliminatory systems are working. The kidneys, the skin, the bowels, obviously. It's all fine and dandy to start sort of, cleaning the liver out and liberating all these metabolic toxins, but you've got to make sure everything's working synergistically at the same time. It's not a one organ game. It's trying to get everything synchronizing together. So that's why you sort of apply alteratives as well, so, and your lymphatics. So herbs like your burdock, magic herb, it's very nutritive. It gets really deep into the tissues to liberate those really deep stuck toxins. And again, if someone's presenting with skin problems and things like that, it's always one of the first herbs of choice that you pull out of the bag. And the good thing about it, doesn't take up a lot of room in a tonic either, so it's good where some of the other ones might require a little bit more space. It's a nice one to sort of put a dash in there as well. Your cleavers or gallium, again, brilliant. I find can interchange that, so if you don't have burdock on the shelf or gallium, you can use either one or the other because they're very, very similar. Gallium is probably a little bit better because it has a slightly higher lymphatic effect. And that's the thing, you've got to get the circulation moving, you've got to get the lymph flow moving, you've got to get those toxins, once they're liberated out of the tissues, you've got to be able to deliver them to the liver. And again, this is very important if people want to try and lose weight and things like that as well, because it's all fine and dandy to sort of get all the toxins to the liver, but we really got to make sure that the liver is really doing its job, So that's, probably one of my favourite herbs I like using. With doing a bit of a cleansing process with that. Just elaborating a little bit more on dandelion. The root is the main one I would use in a detoxification cleansing tonic. The leaf we use probably more for the diuretic effect if that's what you required. So the thing I like about dandelion as well, it's a great bitter tonic, and we need to provoke digestive enzyme function because this is the key to everything. I mean, we all know that nearly 80% of your nutrients is absorbed through the stomach lining, and if you want to get the small intestine to get in the pancreas and the liver sort of all chiming in at the right stage of the digestive process, you've got to start at the very beginning. Dandelion's great for that, so it's a great digestive as well. So if we can help digest and assimilate the nutrients from the beginning, this is going to take a lot of burden of extra undigested food matter finding its way back into the bloodstream, causing the blood to coagulate and thicken. And again, this is going to contribute to allergies and food food sensitivities. And if the blood is too thick and viscous, your circulation is going to get all clogged up. You're not going to get the good nutrients delivered to the cells properly, and everything just sort of becomes very stagnant. So you've got to sort of get the upper digestion working pretty well. Getting the bowels working, like we said earlier, is absolutely key. So there's sort of gentler laxative-y type of herbs like yellow dock. Again, in a formula, I come in at a pretty low dose because that's the last thing you want to do. These are people who have come in to see you, they've never seen a therapist before, they're all a bit wide-eyed about what all this process is about, and you go in there and give them the runs, they're not going to really like that too much. But yellow dock's a nice one, and it's mildly ulcerative as well, so it's a nice all-rounder. If you haven't got yellow dock, even senna, cascara, but go very low dose, I would recommend, in a formula like this. We just want to sort of nudge and encourage this. We don't want to take over the body's physiological functions. We just want to give them a bit of a nudge in the right direction, and hopefully they'll get the message of what they need to do, and then hopefully they'll start taking over and do it under their own steam. That's what it's all about. Even a bit of licorice is very good in a formula like this, because you're sort of going through a detox formula. So you're helping, if you're going to go home and sort of do bring on a bit of a healing crisis, normally in that first week or so, people can feel very weak and very agitated. It's like someone, giving up the durries and stuff like that. You start liberating these toxins too quickly, and the body's not prepared for it. The brain, all the neurons start firing, and you're not a pleasant person to be around. So licorice is very nice and gentle on the guts, great adrenal tonic. It's a nice gentle one to apply as well. Even rosemary could be used in a formula. It's a good nerve iron as well. But rosemary, has circulatory tonic effects and helps with the phases of liver detoxification as well. It's very good with cytochrome P450 pathways. So that's why it's very good as a bit of an estrogen detoxifier as well, and it's great, as a nerve iron, I think I mentioned. And you could probably even use something, even like red clover, because they have mild phytoestrogenic properties. So if you're trying to detox bad estrogen, which is a very good thing to do in that first month of treatment protocol, you want to get the hard stuff out of the way, clean, work with it hopefully as clean a slate as we can, and then we can then sort of work into the next stages after that. So the thing is, you've got to sort of get phase 1 detoxification, working properly. And but where a lot of things start to go wrong is methylation. Most people's methylation pathways are just totally inadequate. And usually it's a snowballing effect. Usually, if that's the case, then there's usually your inflammatory pathways aren't working properly. Your glycation pathways aren't working properly. And a classic example, if you line those 3 big ones up in a row, that's a classic example of obesity. So if you're seeing obese patients present like this, you need to get those 3 pathways working synergistically at the same time. You sort those 3 out, you could almost do most things with that. So we've got to get the phase 1. So again, with methylation, from a nutritional point of view, most people don't realise nearly 1 in 8 people don't metabolise folic acid properly. That is a massive number. And most of the couples that we come in, and everyone talks about folic acid when you're making babies. It's probably next to zinc, are in the top 2 most known about nutrients that the general public always know about, and they all think, I need more folic acid, more folic acid. But one of the big problems nowadays is, again, like these epigenetic problems, or a lot of people have the MTHFR gene defect, where the body just does not metabolize folic acid properly. So sometimes what I do nowadays, and again, this is all to do with the epigenetic coding and things like that, there's been a lot of big leap forwards in the understanding. So I don't like mega dosing with folate. I'd rather go to the good stuff and bypass that and go to the activated forms. Same with the B12 and the other B vitamins. So things like your, like with the B12s, like you've got your methylcobalamin. So these are all methyl donors. The methyl tetrahydrofolate is the preferred type that you can use. And it's nice to adjunct, and obviously, like when you're talking about your B vitamin groups, they all work very much synergistically together. And again, if you get a lot of patients in that you might get ones that are vegans, vegetarians, so you just don't want to assume that they're getting good folate levels because they're getting it from the flora, from their food. Again, there could be massive defects in metabolism. Their body's not converting it properly. And if you get a lot of your big carnivore meat eater types, you think they're getting lots of B12. But again, if their gut flora and everything is not working properly, again, they're not going to be converting it properly. So things that, again, we're talking like your B6s, your folates, your B12s, your trimethylglycines, betaines. So a lot of people that eat a lot of beetroot or beets, and the magic when you're juicing, when you're detoxifying. So like, a lot of times I make like a nice concentrated veggie juice, with most of the standards. Like I like using like a quarter of a raw beetroot, probably 2 celery sticks, 2 carrot sticks, juice it up, make about 100 ml of that, dilute it with some really good quality water, and that's, if you can source spring water would be really good if you know where it's sourced from. Not all of us got an ice braiding tugboat and we can go to the Antarctic and lasso an iceberg and drag it back home for us. So we've got to try and source, and it is the fundamental, obviously, I mean this is everything we all know, but it's the fundamentals we forget as we get along. We try and make it complicated, but you've got to get the essentials right from the get-go. It's like building a deck of cards, and if you don't get the foundation right, it's like building a house. If you don't do it right from the get-go, you're looking for troubles down the line. So a lot of those sort of methyl donor group nutrients would be absolutely magic to include while you're doing a detoxification program in conjunction with your liquid herbs. Most of your sulfur-containing amino acids are absolutely crucial. So again, your methionines, taurines, cysteines, well actually N-acetylcysteine, if you can source that, is brilliant because it's basically a precursor to your glutathione pathways. Actually, most people don't actually realise one of the best estrogen detoxification, I guess, food sources that we can find is actually button mushrooms. So the good old mushroom that you usually find on your pizza is actually one of the best bad estrogen detoxifiers. And while we were just on that, with button mushrooms, if you can get a light exposed mushroom, 3 of them a day can almost get a recommended daily allowance of your vitamin D. And the D is absolutely crucial. When we're talking about, it's emerging as one of the most important nutrients. Everyone needs to be on it. I put everyone on vitamin D. Everyone that's coming in, and a lot of them showing up with blood tests and things like that, their vitamin D status is horrifically shocking. Rarely do I get one that's actually showing in a normal range. And we live in the country of sunshine. So again, this is where we come back where we spoke earlier about your essential fatty acid pathways. You need a proper cell membrane to allow nutrients like vitamin D to pass and to actually get into the cells. And just on vitamin D is probably proving to be one of the most significant nutrients that can actually repair genes. We're not talking the blue jeans you wear to the pub on Friday night, we're talking the other ones. So it is really, really important that you include your vitamin D in all these prepping protocols, because it takes a bit of time for these nutrients obviously to build up to a saturation level. Your essential fatty acids, like we talked about earlier, it takes at least a good month. At least the good thing about it, your body stores it. Getting back to so we talked about folic acid, and a lot of people are very concerned about not getting enough folic acid in their diet. But most people don't realise a large amount of the folic acid, when it's converted properly in the body, is actually stored in the liver. Nearly 6 to 9 months worth could be tapped into. So this is why preconceptually nutrients like your folic acid is absolutely crucial. So if you do a loading dose during that stage, hopefully your liver, if it, again, functioning properly, will store it there. So again, if you don't touch folic acid for most of that pregnancy, especially, I find it's very important up to the end of the first trimester. But if you don't touch it again, your body will tap into it. And you see girls that have a horrific morning sickness and they're up chucking from the day they fall pregnant to the day they deliver the baby. They're barely getting any nutrients past their lips, and baby comes out hopefully fine and dandy. And it's because your body's absorbing those stored nutrients. And that's why we want to make sure that the body is prepped, detoxified properly, and which goes into our second phase, which is basically the nourishing phase. So basically out with the old, in with the new. There's a simple equation I like working with. It's very basic. Basically it goes H equals N over C. Okay? Basically that means H basically stands for health, or quality of health, equals your micronutrient intake over your macronutrients. So the micronutrients, again, your vitamins and minerals, your phytochemicals, herbs, trace nutrients, over the macronutrients, your fats, proteins and carbs. And the thing is that if you look at some of the healthiest people around, they have sort of mastered in a way of getting high dense nutrients, and this is when you get into the superfoods like your spirulinas, again great for the detoxing phase, your spirulinas, your wheat grasses, your barley grasses. Actually maca root is something we haven't really touched on in this series so far, but because we don't apply it in a liquid form because it's a massively high protein dense food, it's one I tend to use as an adjunct with my liquid tonic herbs a lot of the time if we need things to modulate hypothalamus pituitary axis issues and things like that. But very nutrient dense. I mean your bee pollen extracts, your royal jellies, things like that. Be a bit careful with those last two because I don't use them too in high doses unless, especially if someone has got a known allergy, I don't even go close to using them. But they're almost perfect foods. Marine phytoplankton is probably the most nutrient-dense food on the planet that we know about. And these things, you can blend them all, chuck them in a blender. I throw my liquid tonic herbs in there, save time, whip it down, you're ready to rock, basically. And again, a lot of them, again, we talk about you're getting super dense quality foods and herbs. And again, herbs are absolutely magical because they cover most of what we talk about. A lot of them are very vitamin, mineral rich, and the active constituents in there are great. So they're probably a few of the protocols. I know that's a lot to take in one hit. But usually I don't tend to like prolonging a strong detoxification protocol because just in case in the event someone falls pregnant very soon, earlier than we expect, we don't want the body still liberating all these toxins while the placenta's trying to form and things like that. So, but phase one, in usually when applying most couples, we do a bit of a semi-detox. We'll get into doses later on, break down what I would probably use in a liver detoxing cleansing tonic. Another section that I like to apply while we're doing the detox stage, most of the liver, skin, kidney cleansing detox formula we were mentioning earlier, we can apply that for both couples in the first stage. So I usually would sort of run that over possibly 2 weeks to a month cycle, depending on how much we feel that the person may require that. What I start to add in then is, if I find it necessary, is probably more of like a uterine detoxification formula as well. So in a formula like this, I would probably only do this over a couple of weeks or something like that. And I would normally probably do this probably in the second phase of the cycle, so post-ovulatory phase. Again, I would not be recommending any of the patients to be really actively trying to conceive personally in that first month or so, just in case, because we don't want to be provoking, we were sort of doing a bit of a downward effect, and if an embryo does try to implant, we don't want to, stir things up that may cause any problems there. So Dong Quai I love using in a formula because it's great for stagnation and circulatory blockage problems to do with the reproductive system. Peonia, again, if you can probably refer back to our previous DVD, we sort of mentioned these ones quite a few times over and over. Fantastic herb, a uterine detoxifier, helps with the hypothalamus pituitary axis regulation. It has very mild analgesic sort of properties as well, anti-inflammatory as well, but again it has mild liver detoxification properties as well. One that we probably don't normally use or you normally see in the beginning stages of trying to fall pregnant is raspberry leaf. Raspberry leaf we mainly use at the end of the pregnancies to hopefully help facilitate a good labour. But it is a brilliant astringent herb. It is great if a lady was presenting with very heavy menstrual clotting periods as a tonifier to the uterus, and it has great antispasmodic effects, and it is a bit of a muscle stimulator too. So what we're trying to do is sort of tone the uterus up, get it all ready there for the embryo to hopefully find a nice spot to want to sort of implant there as well. Golden seal. Now golden seal's magic, mucous membrane trapper restorative, exerts anti-inflammatory, antimicrobial properties. So again, if there's a little bit of a microorganism issue that we didn't address, like if a girl might have a very, very small touch of pelvic inflammatory disease, maybe a little bit of thrush or something there, but may not show great symptoms, throwing because of the berberine content that's in it is fantastic. So I'd probably put a little bit of golden seal in there to help sort of get that. Another one I like using in the detoxification phase, which was because you've got your other herbs in your liver detoxing formula to do the real heavy duty phase of it, but while we bring this one in, sort of maybe combining it together will really more facilitate helping the hormone balancing and really helping to tonify the reproductive system. So Damiana is another good one as well, because while you're doing the detoxification phase, and actually Damiana is also pretty good if you've got a little bit of, it's like small fibroid there or something, it is actually very good. It's one we didn't mention last time. You can apply in a fibroid tonic, but again it's good for helping to lift the moods, because if you're going through like a detox like this, you're not going to be a happy camper, if you're not used to having this done before. So it's a nice one, and again it has a sort of toning effect on the reproductive suit. It's only gentle, but it's definitely worth considering to add in a formula of that type. So I normally just sort of kick things off with the liver, skin, kidney detoxing formula, get that happening, and then probably in the second half of that, maybe either first month or second month, depending on what's happened, I'd bring in a slightly liver detoxing formula to start getting us prepped. Okay, so this is sort of then transitioning us into the sort of nutritional stage, which is usually from like second month onwards. So things like your coenzyme Q10s. I apply CoQ10 for both couples nearly all the time, and there is a very good CoQ10 product out that also contains a little bit of fish oil. It's got a great little bit of magnesium, taurine. So great as an antispasmodic. But again, when we were talking about before about cellular protection, a lot of these things are all in a formula like the CoQ10, and as we get older, our CoQ10 status in their body really declines. So I like applying that in the nutritional prepping phase. So a supplement like that, with so that's sort of the end of sort of phase one. But then we sort of transition into the phase two. Sort of what we're doing in the phase one, we're sort of getting that nutrient level sorted. But the second and third month leading up to when we normally start to get serious about having a crack at the title, to think about having to try and fall pregnant. Again, this is where we try to correct a lot of underlying conditions. So the endocrine system is, again, we sort of touched on a little bit on the last talk, but I think things like thyroid problems is a big area that we really need to focus on, because the thyroid basically is our body's protector in many ways. The actual herbs, like we use, like bladderwrack, and we'll get into a few of those. Most of the thyroid it's basically like the thermostat. It's the communication pathway between the hypothalamus, pituitary, and the rest of the endocrine system, and everything's got to loop back and go through the thyroid. But so many people are coming in with sort of subclinical diagnosis. So if a lot of girls are doing temperature charts and things like that to try and track their ovulation, and they're finding that their core body temperature is not really rising too well, that is a bit of a telltale sign. A lot of people, when they have come in to see you, usually have had their thyroid tested anyway. So they're looking at your thyroid stimulating hormone, which is quite ironic. So when your thyroid stimulating hormone is high, that means you've got low thyroid. A lot of people interpret that around the wrong way. You think it'd be quite opposite. Then there's the conversion of your T3, T4s. That's fine, but again, it all comes down to how does your cells utilise this? And this is where we're getting into big problems now. So a lot of the nutrients sort of with your thyroid, again, most of the essentials, iodine, tyrosine, they need to convert it. You need your zinc, your seleniums, your vitamin C's. These are absolutely crucial. And your thyroid and your adrenal glands have a very close symbiotic relationship. A lot of the same nutrients your body uses to make thyroxine and things like that is pretty much the same nutrients your body uses to make adrenaline and noradrenaline. So that's going to be absolutely crucial that we sort of get that working. So with the thyroid, there's a few different herbs that I sort of like using. So if someone's been presented, I'm getting a lot of people coming with Hashimoto's. And one of the concerning things is that the actual thyroid hormone aspect of that's being addressed, but the autoimmune part of it's not sort of being dealt with properly. And some of the medications are pretty heavy duty for that. And if it's only a mild case, and sometimes they're put on some pretty heavy duty drugs, the problem is the thyroid will start to adapt to that, within a few years, and you're going to have to take higher and higher doses, so like your thyroxine medication, and your thyroid basically shuts itself down, and then you're in all sorts of troubles from that. So Withania, magic herb, ashwagandha. It's highly praised in Ayurvedic medicine for its use in thyroid treatments, and again, we know it as a magic adrenal herb. And even rhodiola is another one that's great, because obviously a lot of people that present with underactive thyroids or low thyroids are usually incredibly fatigued, and a lot of them may be starting to pack a bit of weight on, and a lot of the girls' menstrual cycles could be a bit heavy and cloddy and sluggish and things like that. So, we've got to get their energy up and going, because, people when they come in to see you, they want to see some initial results. You want to get some acute benefit, but also keep an eye on the prize and help with the long-term chronic aspect. Astragalus, absolutely fantastic herb, and astragalus is brilliant for balancing the T helper 1, T helper 2 pathways. So usually in underactive thyroid like Hashimoto's, you've got a T helper 1 dominance. So we need to sort of keep that down, and that's where vitamin D and things like that are very important as well. So I always like putting astragalus in a formula like that. Astragalus really couples really nicely with buplurum. They use that for organ prolapses, and that's why you find a lot of girls, in time, if that is something they've been diagnosed with, there are 2 herbs you should always reflect back on and maybe consider putting in a tonic if you have any problems like that. But again, bupplurum's absolutely magic, and it helps, obviously with the detoxification pathways. In Taoist herbalism, buplurum is one of those herbs that it's a balancer. And that's why they use a lot in PMS and things like that, so it's excellent. Coleus is another one I like using in underactive thyroid problems, because again, it's has like anti-obesity properties, it's a mild anti-allergic, and it's so diverse on many of the therapeutic applications that you can use it for. So we'll get into doses later on, but usually in the second stage, when I'm sort of getting into the nourishing phase, we need to make sure that the thyroid is doing its job, because if it's out of whack, everything you sort of apply thereafter is not going to be as efficient as it could be. So so always consider getting the thyroid tested with couples when they present, if they haven't already done so. Always look at getting a full hormone function test done. This is absolutely crucial. You can wing it and sort of, as a matter of deduction, deduce from their signs and symptoms and menstrual cycles what you could most likely think is the problem. But it's just nice to have some pathology to basically, it's almost sort of to help gratify what your thoughts were anyway, and it's just there to just sort of back up, yes, I've made the right choice. And sometimes it can make you swing, if I want to choose this herb or that herb, it might just nudge you in the right direction, and when you're constituting a formula together, to try and get it as close to ideal as you possibly can. I'd just like to touch on a little bit more information to do with the thyroid, and particularly to do with iodine. And with the bladder rack, and this is something that we usually all know in a clinical practice, is make sure you get the right type of kelp. You've got your bugle weeds that you use for your overactive thyroid, like your graves and things like that, but just make sure you get the right one, because you don't want to be provoking the opposite effect. The thing with iodine, if you actually remember back to school, in science they had that periodic table you used to work with. And when you look where iodine's sort of situated there, it's absolutely crucial for helping to protect the body from things like chloride, chlorine, fluoride, bromine. So a lot of the stuff that ends up in our water supplies and things like that, and we're exposed to this on a daily basis. Don't go drink the pool water, because it's probably got most of that in there. So, and again, you got radioactive iodine. I mean, look what's happening around the world with all the radiation and like with Fukushima and things like that in Japan. And it's very, very important to get reasonable amounts of iodine in your body. And it's absolutely crucial for fetal development. And I think Mel would have expanded on that greatly, I think, when she did her talk. So iodine's important, but just don't overdo it. Actually, a good way if you're actually using iodine supplementation, if you get it in like a droplet form, you can just, rub it on the skin and basically keep rubbing it until it, leave it on overnight. And if it's still sitting there the next day, that means your body's fairly saturated. If it goes into the skin very quickly, your body needs more of it. So it's a good sort of basic guideline you can sort of use when applying to use iodine as well. So thyroid's very important. Again, we've got to sort of get into this stage is when I start sort of really revving up and getting in the hormone balance stage of the fertility process. Because it's all, like we talked on the previous talk last time, we're talking about the big conditions like endometriosis, PCOS, like amenorrhea disorders, dysmenorrhea and all these type of things. So probably if you get a chance to get a copy of that disc again and just probably backtrack through that, because I just don't want to rehash a lot of the same. So I don't know if anyone's seen the previous DVD before. There's basically 4 fundamental areas that I apply. This is dogmatic law when it comes to prepping couples for fertility. Number 1 is protecting the genetic load of the egg and the sperm. Absolutely crucial. You've got 25,000 chromosomes in an egg, 25,000 chromosomes in a sperm. That's 50,000 problems that can go wrong, and that's why getting the detoxification, getting the methylation, inflammation, glycation, all that sort of business under check in the beginning is absolutely important for protecting the genetic load. So a lot of the other sort of, like your grapeseed extracts and things like your prosanidins and things like your resveratrols and your curcumarins, your green tea extracts and all these type of things are brilliant protectors of the cells. So these are sort of things that you can be also incorporating in this second sort of stage here. So we got to protect the genetic load of the egg and the sperm. The second thing is getting the immune system stabilised. So we want to sort of make sure that the body's immune system is not over-functioning or under-functioning. So we sort of want to quench it down. So if there's history of immune problems, like if someone catches colds and flus all the time, or someone's at the other extreme and is very allergy prone, gets lots of hay fever and asthma and things like that, and eczemas, we need to sort of tailor an immunomodulator that will hopefully bring them back into a state of balance, because nearly 20% of known missed pregnancies can be caused by immune compatibility issues, and getting like those T helper 1 to 2 immune balance happening, and that's where your vitamin D's also come into it as well. Very, very important. So the second big thing is getting the immune system under check. The other big area is really the circulation and blood flow, and I guess we've sort of just touched on that with the detoxification issue, because once we sort of can clean shop a little bit and get things, everything's just going to start working that little bit more efficiently. And that's crucial. Again, we were talking on the previous talk about endometriosis and fibroids and things like that. These are all congestive problems. These are all stagnation issues, and you're not getting really adequate blood flow to the inner layer of the uterus. And again, if you're trying to get an embryo to implant there, and you're not getting, because there's certain carbohydrates that the uterine lining produces, as does the embryo. The embryo produces this thing called like L-secretin, very similar to the stuff around our lungs that makes our lungs expand, and it works a bit like Velcro. It's there to sort of help make the embryo attach properly. And in IVF they've experimented with embryo glues and things like that based on this thing. But again, this is why it's very important to get that blood flow, so the body can facilitate under its own wisdom to hopefully help make these things to allow everything to happen. So getting that circulation and blood flow is absolutely crucial. And basically the big 4 is hormone balance. And again, this is very important. An embryo is not will have a least likely chance of surviving and developing to the next stage if we don't stabilise the hormone feedback system. So usually when the girls are coming in, we have it's good to get a backtrack of at least like the last 3 months or so what their menstrual history has been like, especially if they have been off the pill for a while. So if what I'd ideally like to see is, I don't like seeing girls really have a menstrual cycle later than 32 days and not really probably under 24 days. And I don't like seeing more than like a 4-day swing. So this sort of deduces, is there proliferation stage imbalances, is there probably more so luteal phase stages imbalance, and we'll go through a bit of a tonic at the end of some of the things we might apply for that as well. So it is absolutely important to sort of make sure that, and that's what this prepping phase is all about. It's there to test the boundaries. I mean, a woman may present, she may have a perfectly good menstrual cycle. It could be textbook 28-day cycle, but until you test the hypothalamus pituitary axis a little bit, you may find actually she's on the wrong circadian pattern. So it's a bit like having jet lag on the body, and sometimes just tuning this hypothalamus pituitary axis into the right rhythm, which can take possibly around 3 months on average to try and get that, because it's a bit like a moving target. And that's when you usually find a lot of girls come in, oh, I've got a perfectly good 28-day cycle. We put in we start with this detoxing protocol and stuff like that, and all of a sudden a period might blow out to the mid-30s, and it sort of freaks them out a bit. So you tend to want to prep them, obviously, that this could possibly occur. Then maybe in the second month it swings back. Sort of swings back probably like to 26 days or something like that. Normally on the 3rd month, generally that's when things tend to lock in, and that's usually, and if I observe a lady's cycle doing that, it's sort of almost giving us the green light, saying, look, things are looking and they're responding exactly the way we probably expected it to happen, and this is a good sign that we might start thinking about having a crack at the title. So while you're doing that, you sort of got got hubby sorted out and behind the scenes as well, by helping getting the spermogenesis going and that, because they take it. Phase 1 is protecting the genetic load of the egg and sperm. Phase 2 is basically stabilising the immune system, so there's no immune compatibility issues. Stage 3 is you've got to reinstate good circulation and lymph flow to the reproductive system. And stage 4, you've got to stabilise those hormones. And sort of going on for that, this is dogmatic. I do this with everyone, but like we're sort of probably more expanding on today, we need to sort of really also overlaying that, we need to get the detoxification cleansing processes happening, which sort of they sort of interconnect here a lot. We basically got to get the nourishing phase. We've got to get, once the cells are liberating all those metabolic waste out of the system, we want the good stuff coming back in. We want the really good nutrients, the micronutrients and all that to get in there. And in the body's own wisdom, we'll start using this stuff to basically, the body's geared up to find a state of balance. And that's what we're trying to ideally pursue too. Even if you don't know the cause of why this couple is presenting with fertility problems, most of the time you will, but if you don't, even if you just apply these essential things, the body will normally self-regulate, and hopefully the baby will just come as a result of correcting any underlying health issues that seem to occur. So we get these nourishments, and we've talked a little bit about the superfoods and certain nutrients and getting on a good quality pregnancy multi. So these are all dogmatic law. You just got to, absolutely crucial to do that. And basically then it gets into the sort of the phase 3, which is the nurturing protection phase. So this is usually what we do when we start prepping couples that at that stage, that everything's looking good on paper, it doesn't look any better. Your periods are nice and balanced, your bleed length is perfect, around 4 or 5 days is nice, not too much heavy, probably about 2 days of reasonable heaviness, you're not getting a lot of that brown, blacky, clotty sort of period happening, not too bloated anymore, because these are the great benefits of doing the detox, not getting the sore boobs, the moods are a little bit more under control. So these are all telling us that things are looking really good. And again, if you've had previous pathology, looking at hormone function tests, and maybe if you require to get another one done, say after a few months of being on this protocol, it's sort of good justification to try and match the two up and see, okay, where can we tweak this? Where can we improve it if things aren't responding the way you expect it to respond? So basically in the nurturing phase, basically, and this sort of really crosses over into basically the first trimester of pregnancy as well. So once we're sort of ready to go, we need to make the assumption that just in case the lady falls pregnant, there's probably nearly 2 weeks or so before you've realised that she's got a positive pregnancy result. So we don't want to be going in real gung-ho with heavy protocols. So the first hard stuff is done in the first month or two, then usually by the third month or two I start to scale it down. And if it's the liquid tonics herbs, if I start off at higher dosage, maybe 7.5 mil twice a day or something, then I might even scale it down to as little as 5 mil once a day by that stage, because we just want to keep it absolutely safe. And you've got to protect yourself as a therapist. You don't want anything going pear-shaped, and they want something to blame. So, which if you go conservative, you won't have any of those problems. So this will sort of lead us into, because a lot of the couples we get have already gone through IVF, or already at the last minute thought, oh, I want to go out and see a therapist, one of these naturopathies. I've already had a few goes on IVF, it didn't really work. I've heard that these natural therapies are pretty good, so we might use that in conjunction with prepping for our IVF attempt. One of the frustrating things I see most people when they rock in, they've actually already started the drug protocol leading into their IVF, and they're probably going to get an egg pickup done in only a couple of weeks. So everything we've just been speaking out gets pretty much whitewashed, and then we have to sort of think on our feet and adapt very quickly. So we can't obviously do the ideal protocol prepping that we want to do, but if they want some assistance, we've got to work more from a primary treatment protocol, like you're doing when you're trying to fall pregnant the old-fashioned way, where we now take a bit of a back seat and hopefully work more supportively with your gynos, and knowing sort of the drug protocols that they're probably going to be doing, especially in the stimulated IVF cycle. So because if you're looking at it like with IVF, normally they'll have you on your drugs like your Clomids or your Cenerols or Seraphine, in the first, say, from maybe day 2 to day 4 or day 5, and then they do ovulation monitoring, and then they'll look at doing like your FSH injections leading up a few days before to try and trigger a response. And everyone's going to be very different, and every gyno has a different way of approaching it, like we do. They have a preferred type of drug that they like using from different companies at different doses and things like that. Some are very conservative, and you'll find this. You've probably already experienced all this anyway. Some are, they're not really into this natural gear, because they don't know much about it, so it's best not to touch it, and it sort of makes the patient really in a very awkward situation, because your gyno is telling you one thing and your natural therapist is telling you something a bit different, and they're just thinking, oh Christ, what am I going to do? And a lot of times they're sort of doing this on the sly a little bit. But you get some really great gynos that are very open-minded, and they embrace a lot of the natural therapies, and some don't mind, just as long as you don't go too crazy. And that's one of the things I tend to back down, and that's why I tend to go very conservative. I know a lot of the top gynos around the country, and the protocols that they apply, and you sort of have to then sort of cater your treatment protocol possibly to what their program is like. So I like scaling the herbs probably down a little bit, mainly in effect because, again, at the last minute they may want to up the doses, like the FSH. They might want to max it out. If a lady's already had quite a few goes of IVF and her ovaries aren't responding, she might have had a blood test, and she might have had an anti-Muellerin or an AMH blood test performed, which is sort of giving an indication how the anterior follicles are functioning. So it's really the gold standard marker they're using at the moment to really test for ovarian potential. So it's really showing really how many eggs what they say is how many eggs you probably still have left. But I'm starting a little bit sceptical on the AMH results, because I think, if you've been chalking up with endometriosis and things like that, I think you can still get a lot of false negative readings come back. And most of the ladies that come in that have had that test done, it's been very rare in my experience. I've actually seen one that's really showed up with a decent result. and 9 times out of 10, touch wood, we've been very lucky to sort of hold the tide back and hopefully got some a decent winning follicle to be able to mature, and they've gone on to have babies, and when they were told they wouldn't have to. And I think in a way it's rushing a lot of couples in through IVF a little bit quickly nowadays too, with that sort of result. So basically, I scale the sort of tonics down leading up. So basically, once we start the trigger hormones, like the FSH hormones, so about 4 days or so before they're talking about doing an egg retrieval, I tend to scale the hormones right back down, because what I don't want to provoke a polydrug effect. Because some of these herbs and that, in some ways, are there also to help, modulate LH and FSH levels. And if the doctors are, working on their dosage range, and we throw something in that can actually magnify that effect, what I was concerned, I don't like pushing people into a situation where hyperstimulation could occur. It's a very dangerous condition. It wasn't that long ago, back in the day, that girls could die from it. And so one of the things I also like to include a lot, say if you are treating a couple that is prepping for an IVF attempt, at least 7 days before and after an egg pickup or transfer get them on some extra protein. Even if you're telling them to rock down the shop and get some old sustagen or something, but a protein. Again, if they're vegetarian or vegan, obviously go like a rice protein or a pea protein base. But if they can tolerate it, just a good whey protein. It can help them minimise the risk of fluid imbalances in the body. And one of my concerns in IVF, I tend to be a bit more favoured in recent times to frozen transfers, mainly because the body's not loaded with all these drugs, and unless they've had the great benefit of us beforehand doing all this detox stuff like we've been talking about, some of them are still holding on to a lot of those chemicals in their body. I mean, Clomid, for example, has a massively long half-life. It's a very old drug. And the concern is the more times it gets used, the more it disrupts the endocrine system. So if you have to use it for a couple of months to really provoke ovulation occurring, sometimes if the herbs aren't doing it, then it is one there I like to tap into from the doctors to provoke that initial ovulation. But it's a bit like trying to pat a flea with a hammer. If you get it wrong, you can make a real mess of it. But Clomid definitely has a long half-life. So even if you the girls haven't been on it for a while, and a pregnancy occurs, and they start turning over fat tissue, the concern is the drug can actually find and liberate it back into the bloodstream and still cause a hormone disruptive effect. And the overuse, there's a lot of documentation of birth defects and things like that. Again, that's why I like doing the detoxing protocol, to sort of get rid of that stuff if they've been on courses that especially beforehand. And I find a lot of the girls, once you apply a treatment like a detoxing protocol like that, and they have been on Clomid or something fairly recently, I find a lot of times their hormones do blow out. And it could be an absolutely blessing in disguise that they've actually done this. They really needed to do this if they want to have another crack at having a prep, because it's all about getting them in the best physical shape as well with the IVF. So hopefully when they're on their drug protocols and that, they're going to work as efficiently as they can, their body's going to handle it more efficiently, and it just hopefully is stacking the odds in their favour, so they're going to have a greater successful outcome. So certain things, when they're prepping for the IVF, I always put them on the essential fatty acids. Q10 Complete is one of my favourites. I like that one because it's nice low dosage range. It helps with the energetics type of things. It gently helps the circulation, and it sort of potentiates the effects. And a little bit of taurine in there is very good to help get rid of that backwash of toxins. But I think in recent years, because of the development of the way they incubate the embryos nowadays too, they're getting a little bit better at nourishing the embryo compared back, IVF's been around 30 odd plus years, and back in the day the agar dishes they used to sort of store the embryos in was a bit crude, because you're really trying to mimic as ideally close to the uterine environment as possible. So in some aspects of IVF have improved a lot in recent years, and obviously the refinement of some of the drugs, the reactions, how many and how those eggs are graded, if a couple's going to put 1 or 2 embryos in. Normally the older girls, like once you get into the sort of mid to late 40 category, some are encouraging to probably do 2 embryos. And again, there's not a lot of shopping days left till Christmas when you're in the sort of mid 40 range. So normally, if you're up for it, you might go away with twins, but a lot of the times maybe only one of those embryos might be viable and take. So basically, once they've done the embryo transfer, the gyno will have you on progesterone of some sort. So either that's going to be in a form of a pessary or a cream. Some gynos don't mind using, some put you on like baby strength aspirin after a transfer, so something like Cartier or something like 100 milligrams. And in some ways there's been a lot of studies around the world, and I guess we could even apply that to even willow bark or something like that. The carrying a pregnancy to term rate in some of these studies has actually improved by nearly 50%. So when you look at it, it can help with the second and third major causes of why threatened miscarriages occur, which nearly does account for probably 50%. So some gynos into that. Where girls aren't very responsive with a lot of their IVF drugs, like they've done a round and it didn't work very well, and sometimes that's when they pull out like DHEA. And normally they will prep you maybe even for a couple of months before going with IVF. So they normally dose around 25 milligrams 3 times a day. I find I don't like them on them for too long, because the same problem, your adrenals are going to get very lazy after being on that, and they will start losing their adaptability to produce their own form of DHEA. So that's fine as personally, I think, as a last ditch effort. If you've tried every other trick in the book and everything else is not working, some of the gynos like using the DHEA, trying to sort of, turn the clock back a bit with the eggs, and help provide the building blocks for all those steroidal hormones to hopefully sort of give those ovaries a bit of a kick. So basically, if we were prepping couples with the IVF, I would break down 2 probably half tonics, probably just about 100 ml tonic of each. So I'd probably do an assisting ovarian tonic, so in the follicular or proliferation stage. So basically I would start it probably once the period is finished, so probably around day 4 to probably day 12 or something, or day 14, depending on the girl's ovulation cycle or when they're planning on doing the egg pickup. So in an ovarian stimulating tonic, I'd probably use something like, again, like Chase Tree, Vitex. It's the greatest, in my opinion, it's one of the best all-around diverse herbs, and even though I've used it in this and it does help with an ovulation induction, normally you would associate using it in the second half of the cycle, but in this case we are needing to contain this estrogen dominance, which is usually what's buggering things up a lot, and we're just sort of hopefully not going crazily with the doses, but we basically need to help support proper ovulation to occur once they do an egg retrieval. Okay, so Vitex is great. Shatavari, brilliant herb, one of the greatest herbs. Brilliant, again, it sort of has a phytoestrogen mimic effect, so basically helping to couple into the receptor sites to prevent the body utilising bad estrogens as well. It's a very good herb for that as well, and it has adaptogenic properties and that. And again, leading up to that, those couple of weeks before a girl's doing her egg pickup, she's going to get very, very stressed. So we need something that's just gentle, but it's a really nice all-rounder. I use a little bit of Schisandra, actually, again supporting slightly that